Hi, my name is Katie Walker. I am the CEO of Revitalist, and tonight we're going to be talking about 3 service lines that we offer, including vitamins, ketamine, and Spravato. Tonight, I may be randomly joined by our therapy dog, Dante, who may be walking in the background behind me, just in case someone needs that kind therapy dog reassurance. So, what do we have going on today in society? We have a lot of information out there to where if you want to understand and you want to rationalize your case, you can. What does that mean to us? Is that there is a lot of good data out there. There's some skewed data, but we can look at the data and try to understand, how can we use it for our care? How do we understand it? How do we actually make a validated decision based upon the science that we do read versus the articles that we see versus the things we see on TV? It's a very confusing world right now. And at Revitalist, what we pride ourselves in doing is we pride ourselves in being advocates for others. So my background's in nursing. I am a CRNA, which is a certified registered nurse anesthetist. Basically, I've been in the medical system for about 20 years, worked 10 years in the ICU prior to going back to anesthesia school. Now I've been doing anesthesia for the past 10 years, and 4 of those involves running a ketamine clinic to where we actually do give ketamine, Spravato, and vitamins. So what I want to do tonight is to kind of lend a hand to where you guys can understand more so what's going on in society, and to where everyone can kind of step back, reanalyze, and use the best information out there to help guide the care that they have. So what we have seen more so in the outpatient community is there is not a very integrated team approach, unlike there is in the hospital system. And what I mean by that, if there is a trauma that comes into the hospital, you're going to have about 10 of the top specialists on your case in order to try to save your life. What I have seen in the outpatient world is there may be a condition to where you may go to your primary care may not understand it, therefore they're going to send you to a specialist. The specialist may be a rheumatologist, a neurologist, a psychiatrist, an orthopedist, anyone like that, to where that individual of that specialty care may be able to make their judgment based on that one area that they are analyzing and reviewing and studying, and that may be their field of expertise. But what we're seeing a lot of times in the outpatient world is that specialist may not always communicate to the other specialist, leaving the client or the patient kind of a loss of words, a loss of confusion, to where they just don't understand the data, the things that they're being told. They don't understand the interpretation from the physician and or nurse practitioners or naturopathic physicians, whomever. They don't really understand that terminology because they've not really been in the system and have been trained to the levels that, we have been trained. So I went to undergraduate school, got a 4.5-year degree as a registered nurse, did my pre-medicine prerequisites because at that time I felt like I wanted to go to medical school, changed my mind with that, went to anesthesia school instead. And now actually I'm back in school getting my psychiatric degree. So I've been in school for approximately 11 years. So, it's one of those things to where you can really understand, a little bit more as you go, but also you have to hear this stuff over and over and over as a medical professional in order to really comprehend it and master it. A lot of these courses that we used to take, and I think anybody in the medical world could tell you this, is, a lot of times anatomy and physiology and things like that. Those are situations to where the first time you take anatomy and physiology, it may be confusing to you. The second time you take it, it's less confusing. The third, fourth, fifth time, as you're doing your master's degrees and such, I think I've now taken 14 pharmacology classes to where pharmacology, it's pretty routine. It's the same way, like my husband is a heart surgeon. Heart surgery, he makes it look easy because he understands the whole party from the inside and out. It's no longer complicating to him. So that's kind of what we want to do, is we want to kind of share our experience from what we've seen, what we understand, in order to be an advocate for you as a client, as an advocate for yourselves and such, to where if you do have questions following this discussion, we're going to be happy to answer any of those questions. And, if you want to call, just seek out additional information. We're happy to help out with that too. So let's start with ketamine. ketamine, what is ketamine? A lot of people, I feel like more so people will think that it's a street drug, or excuse me, one second. Come here. Here's a therapy dog if anybody wants to enjoy the therapy dog here. But so ketamine, what is ketamine? It is a medication actually that is derived from a lovely strong drug called PCP, which is also known as angel dust. Back in the 1950s, they recognized that angel dust had anesthetic-like qualities. So therefore, they sent PCP into the lab in order to get ketamine derived from it. So what all does that mean? Because PCP, if anyone knows what PCP is, it's a very scary, very strong hallucinogenic. So prior to the 1950s, the anesthetic drugs, if you remember the people back in the Westerns and the old movies, whenever they had to have surgery, they would more so bite on a belt. A lot of people chose to bite on the belt because all the other anesthetics that we had were much more dangerous. So when I say dangerous, I mean that a lot of them actually caused you to have seizures, or they were explosive, or they caused hepatitis. So if you go back to the old hospitals, a lot of the operating rooms actually sit away from the hospital. And that was because that was to protect the other clients that are the other patients in the hospital and the staff and such. So ketamine, when it got derived from PCP, it's actually 1/50th the strength of PCP, and it's a third line cousin. So it's, even though it's derived from it, it's kind of like comparing an oak tree to a seed. Ketamine has the qualities that the scientists wanted it to have, and that's the reason that they extracted it in the quality that they did. So ketamine actually in 1970 was first approved for use as an anesthetic drug. So anesthetics, it's actually called a dissociative anesthetic. And the first place that you used ketamine was on the war fields in Vietnam. So it was battlefield anesthesia was where they used ketamine. The reason this happened was because ketamine is such a safe drug that they were able to use it in very complicated situations, and they didn't have to worry about supporting the additional organs like we have to do with other anesthetics, because ketamine does maintain the cardiac and the respiratory resistance much better than the other anesthetics that we use today. So ketamine in the operating room, typically the doses that we give are pretty high. We have two therapy dogs here now. So you have, this is Dante and this is Orion. So I hope they make you as calm as they make me, except when they're playing too loud. So ketamine is a medication that we use a lot in the hospital system. We use it in such high amounts that it actually does have a lot of side effects that they're not necessarily dangerous in the hospital system. They're just not very well tolerated, and they're not fun to deal with. So with ketamine, we actually we'll put a lot of different medications with ketamine to make it synergistic, to where we only utilize ketamine for the aspects that we want and not the aspects that we don't want. So CRNAs and anesthesiologists, we both are probably, not probably, we are the top experts with IV drug, IV medications in society. That's kind of just the way that we're trained, is with the IV medications. We like we like medicines. We think quickly. We like medicines to actually be the best concentration possible, and then also with the quickest effect. This is Max. Max is the puppy that's in training, but he gets in trouble. So he runs because he opens doors, and he can't really he can't be a therapy dog yet. So we're working on it. So ketamine, pardon this. Ketamine is actually, it's like I said, it's been around for a long time, since for 50 years it's been around. And in the late 1990s, Yale University, they were using ketamine on animals. I don't think they've ever used them on Great Danes, but maybe they have. But they were utilizing ketamine on rodents to try to induce schizophrenia. And they recognized that ketamine was actually making the rodents less depressed. So what does that mean? That means that the whole neurologic theory behind everything that we know with the brain changed, meaning that the neurologic theories that we thought we had with mental illness, to where your environmental familial factors may have aligned there, actually may not be. So Yale University was actually seeing real-time changes with the brain with ketamine with these mice, and they saw that they were becoming less depressed. So Yale was able to actually be the first of its kind to start documenting real-time evidence showing that the brain actually was able to regenerate on its own. It wasn't just an eclectic organ, that it actually did function similarly like the other organs that we have. So what we've really noticed with ketamine, since we've been given these infusions since 2018, is that ketamine is able to break the cycle of what the brain's doing sometimes. So we're able to look at the neurologic functionality, but also the behavioral aspects and the conditioning that we may have or may not have, to where when ketamine is given in an appropriate setting by a professional who understands what they're doing, they are actually able to look at not only the medical aspects, but also the mental health aspects, to where we're able to integrate this fantastic organ that we have in our brain that unfortunately leads so much more of our life than what we know. And we're able to actually look at that on real-time data, to where we can look at MRIs and PET scans and EEGs. We can see what's underacting and overacting. We can also look at the behavioral aspects and see the conditioning pieces to see, why are we going down this road? Or, oh, I didn't know I was doing that, kind of thing, to where the brain is made to protect us. Period. In discussion, the brain is made to protect us. It's made to keep us alive. And there's two big systems in your system, called your sympathetic nervous system and also your parasympathetic nervous system. And what they see a lot of times is people that are really struggling with mental illness, their sympathetic nervous system may be in overdrive, and no one really knows how to readjust that. So what is your sympathetic nervous system? It is your fight or flight. It is basically, do you fight a bear? Do you play dead from a bear? Or do you run from a bear? So that's your sympathetic nervous system. That's what goes into gear when your brain feels threatened or your body feels threatened or something like that. So once those incidences occur, sometimes they apparently stick around for one reason or another. And your brain evolves around that situation that it didn't understand, because it doesn't want a situation like that to happen again. So if you've had acute loss, if you have ever been strangled, if you've been in an abusive relationship, if you've been attacked by a dog, there's going to be a lot of things there, to where your brain has evolved in order to protect you. And by doing so, it will send you natural triggers to say, hey, you need to be aware. And, and that's kind of your subconscious, which is your, part of your sympathetic and your parasympathetic system. But also, what it also states is, after a situation like that happens, then your brain is of heightened awareness. It's of a heightened nature, to where you, a lot of times, though you consciously may understand the whole situation, you can analyze it, you can understand it, you may go and do anything and everything that you possibly can do that's within your control, and you don't feel like you're getting anywhere. A lot of times what we're seeing is that you're not getting somewhere because your brain may have held on to an angle that you didn't even understand, you didn't even recognize. It may be something that's so subconsciously simple that you would never even think to look at it that way. So what we see, what ketamine does a lot of times is ketamine is actually able not only to give you that regenerative aspect of brain health, but it's also there to help your brain to understand an angle that it may have gotten stuck on. So a lot of times, if you look at trauma, so what is trauma? Is trauma the military? Is it me getting my leg blown off? I actually have two legs. So, don't think that I don't have legs. But what I'm trying to say is, trauma is the way that we perceive it. And that's any person. That could be a 2-year-old to a 20-year-old to an 80-year-old. It could be someone in the military who they do have more heightened times to where they can experience trauma. It may be an elementary school child that hears a statement from their teacher that they just don't understand. So trauma is something that's interpreted and heard that isn't always understood. So our brain is very objective, very, very steps oriented, right? We really like things to go our way. We want to wake up in the morning, we have a routine, we have all this stuff going on. Well, say we wake up in the morning and, there's a tornado in our house. Our brain wouldn't understand that necessarily because that wasn't the objectivity, that wasn't the objective scale that our brain necessarily had that we understood. So what does that do? That tells our brain we didn't understand something and maybe we should be aware of this, because how are we going to prevent that in the future? How are we going to evolve that way? So I talk to people a lot about evolution of the brain. So evolution, I know that's a controversial topic, but if you are sitting there, if there's 5 of us sitting somewhere and something happens traumatic, the traumatic aspect is, it's not, well, here this comes. Like if a car comes into my house right now, then what do? The 5 people sitting there are going to respond a similar way that they've responded in the past to save them. So if it's me, and I've been an athlete most of my life, if it's me, I may, bob and weave and jump out. If it's a military person, they may do something from their military skill set. If it's a teacher, that teacher may do something from one of the drills that they run. They call it muscle memory. It's not muscle memory. It's the brain remembering situations. So it's just very similar to, you're going to ride a bike, or it's like riding a bike. We've all heard that. So just like riding a bike. Your brain remembers things from the past and it holds on to them. So what we want to do is we want the brain, yeah, absolutely. We want the brain to learn and grow wise and everything else, and then there's always the joke with wisdom. How do people get wise? They make a lot of bad decisions. So, what we want to do is we want to take all that into consideration. And then as we go along in life, we want to understand, why would my brain be doing that? We don't want to be afraid of it. We want to try to understand it. If we can understand it, then we can empower ourselves. So what I've learned a lot from, working with clients with these infusions is what we're able to do is we're able to have the medical aspect that my team provides, to where we're able to, speak comprehensively. We're able to listen. We're able to understand that the neurologic aspects. We're able to do a neuro exam or a psychiatric exam or whatever type of exam you need, kind of thing. We're just comprehensive providers. So we can hear the functionality piece from it. We can understand, the activities of daily living that may be skewed. We can understand that, there may be stressful situations that you're not dealing with, or why, things like that, to see, like there may be an imbalance. Insomnia is huge with a lot of clients that we work with, and some of that can be anxiety, it can be stress, it can be depression, it can be, narcolepsy that a lot of people get, diagnosed with eventually. There's just a whole slew of things that really just come up to the plate, and people, it's almost like, it used to feel like it was just one thing. Now it feels like it's 10 things, kind of thing. So what we do at the clinic is we have clients, or we have providers like myself, that are able to, sit down with you and try to understand this comprehensive view. Well, what we do too is what we work with mental health providers, and a lot of these mental health therapists. I'll say mental health therapists. What our mental health therapists are known to do is they are known to help the brain to integrate. The brain goes to polarities. They help the brain to integrate. They help the brain to understand. They help a person to understand themselves and all this other stuff, to where don't be afraid of your brain. Try to understand what it's doing. If you can understand what it's doing, even though it seems so complex and so stubborn and very, very frustrating, your brain is an organ like anything else. Unfortunately, we can hear the thoughts that it's having. So, with the brain aspects, what you want to do, instead of being afraid of things, instead of feeling depressed or feeling shame or feeling guilt, is to try to learn wait a minute, what's that feeling, kind of thing, and try to learn to identify it. And that's what I've learned, with the therapists that we work with, is, a lot of people in life, they feel a certain way and they don't allow themselves to feel that way. A feeling is a feeling. That's all it is. It's not necessarily real. It's a feeling. It's something that's there to be heard and to be understood. And what we're learning is the less that we understand that feeling, the louder it gets. And the louder it gets, then it starts having something more of a sensitization issue per se, to where you feel like that feeling gets worse and worse and worse over time. And then it starts affecting other parts of our lives and other parts of our system per se. So they've proven that mood and pain are directly related in the brain. So, if your mood gets worse, your pain gets worse, your mood gets worse. And, I think a lot of us can probably identify with that, talking about, when we don't feel good, we don't want people to touch us. Like, you have body aches. When you don't feel good, you get body aches, and people, that may be an inflammation, that may be a temperature, who knows really what it is. But they've proven that chronic mood leads to chronic pain leads to chronic mood. So those are things, you want to keep in mind. So why is mood and pain, why are those two things so complex right now? Maybe they've always been. They're so complex because they're the two subjective things that we have to deal with in life. So my mood, I may be conditioned completely different than you are, but my mood varies depending on my patterns and my personalities and everything that I have going on in my life. Pain is a very similar thing. So pain is also subjective. So my pain, come here. My pain may be different than your pain. I may interpret pain differently. I don't know if you've ever had hot tea or a piece of ice on your tongue. And if you've ever sat there, so people in my field, being CRNAs, we're considered pain experts, right? So if you've ever sat there with when your mouth's so cold or something, tea's so hot or something like that, have you ever sat there and analyzed what does that actually feel like? What does pain mean? To where, pain's different for everyone. And that's why pain's so difficult to address, because it's subjective. Providers go by what you're telling us. And then unfortunately, if you're telling us that you're in too much pain, you're telling us that all of our adjunct medications are not working, then we don't believe you anymore. And then we just go based upon your vital signs, based upon your breathing, and based upon your oxygen saturation, your heart rate, and everything like that. So you may be in pain, but your vital signs may not be showing that. So therefore, then what do we do? What do we do with a client who's lost their right arm, but their right hand's killing them? What do we do? In medicine, a lot of times we don't know how to address that. We have no idea how to address that. When your right hand's hurting you and you don't have a right hand, we call that phantom limb pain. And it's one of the most difficult pains that you can actually address. So what we've learned, what ketamine does, is ketamine actually goes in and resets the brain. It resets all these pathways that it's going down, because the brain admire its strength, admire its complexity, but don't let it get the best of you. So you may be going down this one path of pain and mood and insomnia. When I say pain and mood, I mean anxiety and depression and PTSD and burning, stabbing, stinging in your ankles, in your wrists, in your shoulders, a whole sorts of things, to where if we can reset your brain to what's going on, then your brain actually says, oh, okay, I understand this now. Your brain is very, very smart. All of our brains are very smart. What I like to tell people a lot of times is, even though you feel like you're, don't ever categorize yourself as being sick, as being mentally sick. If you say you're mentally sick, and there's nothing really you can do about it, then what kind of goal set does that give you? So what I tell clients a lot of times is, your brain's just on the wrong path. Let's see if we can get it back on the right path, because your brain knows how to function. And it does. Your brain very much knows how to function. For one reason, your brain may be in survival mode. That's something that we see a lot, with our frontline, your police officers, your firemen, your veterans, your EMT, even teachers right now with COVID having to switch, all these different hats and hoping that their children are going to thrive. What we have to do is we have to give the brain a chance to step back and to heal itself. And it can. That's what they've discovered. That's what. So some of your biggest universities that you're doing the research with all of this are Yale University, Oxford University, Harvard, Johns Hopkins, Cleveland Clinic. There's so many out there right now, and that's the really exciting thing about ketamine is it is the most unbiased data across the entire world right now. There's no money in ketamine. A lot of people do not like the big pharmaceutical companies. A lot of people do not like Western medicine. A lot of people with Western medicine think that Eastern medicine is ridiculous. So what I'm telling you is to not go against any necessarily, but to be considerate of all. So are there some techniques in Eastern medicine that may work well? Sure. Are there some techniques in West or some techniques in Western medicine that may work well? Absolutely. Do the big pharma companies, do they have a very heavy presence? Sure. But what I'm telling you is to be considerate of all and try to use the data, try to use your practitioners in the medical world the best you can in order to help you to make the best decision possible. There is a lot of data out there. I know there's a lot of social media groups sometimes and people, giving advice and such. And I think that's fantastic. I think support of each, I think is wonderful. I think there's a lot of providers out there to where clients may not always trust them over time. And I think, that's what they say, it's the art of practicing medicine is the art of nursing. You've got another human being that you're relying on their knowledge and skill set to best guide you. And I think that, you take that stuff into consideration. And if you don't understand stuff, hopefully you can find a medical provider that's willing to sit down with you and break it down into layman's terms to where you do feel like you can have that angle to best help your conditions. So if you're struggling with things, with anxiety, depression, PTSD, suicidality, even a piece about suicidality, 70% of people have suicidal thoughts. So what does that mean? That means if you're having suicidal thoughts right now, you're not alone. Try not to let them scare you if you have them. There is a pattern. There's a reason a lot of times as to why people have them. Women a lot of times have a very high executive function, meaning that we'll go through the day and we'll take care of everything. And then at the night, we slow down. And then that's kind of when our waves of thoughts come across to where a lot of times, women may feel more suicidal ideations when they are very, very stressed or when they're very, very relaxed. So it's kind of the polarities with that. Men, honestly, I don't know. Men, well, we'd have to ask one of our therapists, one of our male therapists, Jeff, probably about the men aspect. He's really, really good. And hopefully he'll be on one of these talks with me very soon. But Jeff can really kind of tell the neuro psychological aspects as to why suicidal ideations do come to the surface sometimes. And I think the more that we can understand these thoughts instead of being afraid of them, even as, not even just clients, but even as society, to where when we have these thoughts, when we have these feelings, the more that we can get, the closer we can get to them not scaring us and for us to understand them, the more we become empowered in who we are. So none of us are bad people for having negative mental health or negative pain syndromes. We're not bad people. We're doing the best that we can do. Do we eventually develop negative coping mechanisms? Absolutely. And those negative coping mechanisms may be, addictions. It can maybe, physical abuse, psychological abuse. There's a lot of negative coping mechanisms. And for one reason or another, if you talk to people who are in those patterns, if they can understand those patterns at that time, a lot of times they'll tell you that they don't know how they got that way. They have no idea. And that's what we really want to do at Revitalist is we really want to just push forward to where people can understand themselves more. They can understand their personality patterns more. And then the more you do that, the more we understand ourselves and each other, the stronger that we become. And when I say stronger, I don't mean having strength over others. I'm meaning being strong and secure in who you are. And there's a lot of that going on right now in society to where people, are very, there's a lot of opinions out there based upon everyone, right? So, at Revitalist, we're a place of comfort, we're a place of acceptance and professionalism. And then we also, if you come to a Revitalist, you are a person, like we all are, except Max. This is Max. Max is our big one. So when you come to Revitalist, you're a person. You're a person we respect. You're a person that will maintain your privacy. You are a person that we are here to help you to feel like the person that you feel like you are, that you're not right now. And that may be, that you feel skewed, you feel off track. You don't know, sometimes it just feels heavy. So what we typically will do with clients is we will have the clients come in. If people sometimes know what they want, but they know what they want, we set them up with an appointment for a consultation with a provider. If they don't know what they want, then we will, a lot of times if they just are looking for a therapist to talk to, we have a lot of therapists on standby that can help, them to try to understand, which path may be best for them. Some clients will come in and it just may be stress, or it may be grief. We just don't understand, because a lot of our studies growing up don't include this, much like paying bills and taxes and all that stuff. We don't really have a lot of thought processes on the way our brain works. So at Revitalist, this is kind of what we want to do. We want to advocate for people. So ketamine infusions they're fantastic. If you feel like you are of a treatment resistant nature, to where you have failed 2 lines of therapy, and if you're struggling from chronic conditions, so PTSD, anxiety, depression, suicidality, obsessive compulsive disorder, even pain syndromes, phantom limb pain, fibromyalgia, interstitial cystitis, and such. There's a lot of, just various pain syndromes, to where, if you've had surgery on an extremity, and say, I had my left shoulder operated on, and the pain's still there, and I wish I never had this surgery. And actually the pain's worse. The pain's bigger now than it was. And then if I go back to the surgeon does a, MRI or whatever they do to, look at your shoulder. And then they say that, well, your shoulder's fine. Anatomically, there's nothing wrong with it. I mean, we can go in there and we can rinse it out and look around and, do anything. I just need any type of relief. So, maybe the surgeon goes in there and looks around and everything looks good, and they sew you back up. Well, then your pain's worse, or it stays the same. So a lot of times what that is called is complex regional pain syndrome. So CRPS, that's something it's becoming a little bit more common in the orthopedic world, but not too much. But complex regional pain syndrome is really just pain in a certain area, and it makes no sense as to why. So the therapists that we work with at the clinic have often said, that pain actually, that pain actually is something. That pain actually is something that, it's something that's more trauma related, to where the trauma is locally bound, instead of being in your brain, that the trauma is actually pain in that area, right? So what ketamine does a lot of times is ketamine just helps the brain to process trauma. And what we've seen is trauma a lot of times is the root cause of a lot of these mood and pain disorders. So if we're able to really address the root cause of what's going on, then we're able to help you to break that cycle. And that's kind of the interesting thing about ketamine is, it's a medication that's acting as a catalyst to cause a synergistic reaction. It's basically telling your brain to start fixing itself. So, a lot of times with the mood, it's a 40-minute infusion, but the brain keeps doing stuff for another, 4 hours after the infusion's over, to where people can start seeing, more real-time results. So that's kind of the neat thing is, we're not with ketamine, we're not giving you something. We're not giving you something to suppress symptoms. We're giving you something to regulate. So, with mood's cyclical. We go up and we go down. And that's normal. We have some days that we're exhausted. We have some days where we have tons of energy, and that's just the way life is. It's not very linear with the brain and the body. So ketamine, what it does is it really helps to bring those emotional regulations back into play. So I'll tell people a lot of times, I'll ask, about when did their mood stuff start. A lot of people usually can identify that. They also can identify that sometimes there was a significant situation around 6 months before that mood aspect started. And that could be, acute loss, rape, life changes, significant changes, things like that. To where, about 6 months later was when the mood swings started. And then over time, the mood swings get worse because they've proven that your brain duplicates what it knows. And after those mood swings get worse and you're unable to identify it, well, then you go to the physician, you tell them, or the provider, and you tell them how long this has been going on. And then they will tell you, well, I think it's probably depression, or I think you have depression and anxiety. So, that's kind of the mood swinging. And if it duplicates over time, it gets worse. And then the depression, anxiety, may eventually turn into other conditions, which may be bipolar or schizophrenia and stuff like that, if we can't really, slow the course of the action or course of the path down. So ketamine a lot of times is able to bring a lot of that stuff to the surface to where it really gives you a very special sense of clarity, especially sitting with the therapists that we have in the clinic. To the therapists, I'll tell people a lot of times, you give those therapists the stars, they'll help you to make the constellations. If you're able to make the constellations, you're able to understand the whole picture. If we're able to understand the whole picture, then we get the acceptance and the integration that we're seeking. Otherwise, we don't feel like ourselves. We can't sleep. Everything's off. We may sleep 14 hours a day and still feel exhausted. We may not be able to have, any type of quality dreams. We may have sleep paralysis. Anything to where people just feel like they are off. That is what happens. So that's kind of the piece, where ketamine kind of comes into play. So it's been around for 50 years. A lot of people say it's a new technique. It's a new therapy. And it is, it's been around since the late 1990s. So it's a little over 20 years old. So what I'll tell you is, I'll give you a challenge is if you want to, really research something, then go out and research ketamine yourself. There's a lot of good stuff out there. You can go to Google Scholar and it's got a lot of really good articles out there by a lot of really credible organizations and institutions. So the youngest we've treated at Revitalist is 12. The oldest we have treated is 89. We've had people with complex grief and anxiety and depression. Excuse me. Anxiety and depression, suicidality and such, to where these clients they've done very, very well. Excuse me. It's very tiring to try to understand what's going on in your brain sometimes. And I think over the course of years of us trying to understand it in a unilateral view and not feeling like we can talk about it to other people, I think it's kind of refreshing for somebody to sit down with you and say, excuse me, to say, I get that, I understand that. You're actually following a similar pattern to other people. And to have a therapist to say, why don't you try these techniques and maybe that will actually help. Clearly, I'm allergic to dogs. So with these, new techniques happening, I would ask you to, look at considering these things. Ketamine's been around for a long time. It is a drug of abuse at times. Excuse me. It is a drug of abuse at times. And what we do at Revitalist is we actually do not provide any type of external prescriptions. The reason being is because in the States or maybe in the world, we can't regulate ourselves. We may think we can, but we can't. That would be, can we regulate ourselves on food, shopping, drugs, sex, sleep, work? We're very, very forward driven, even education. Look at the academics that we push our kids through. Because, we want them to be good. And do we know what good enough is? I'll tell you, I don't. I've recognized that a long time ago. I recognize that I feel like in my brain, I will never be good enough. So I understand that because I just don't think that my brain can measure it. And as an American, can we measure what's good enough? I don't know. Can we? So at Revitalist, we expect that might be a troublesome situation to a lot of people. So therefore we do, just the IV, which is the recommendations with all the evidence-based data. There's a lot of people out there that do oral ketamine and the nasal ketamine that people go home with. The reason we do not do that is because there's not a lot of evidence-based data that supports that really working, very effectively to where it's not hard on the other organs. So we just stick to what we know. And we've had a lot of really good success, maybe 85% in a lot of our cases for clients who really stick to, what we recommend. So there's an induction cycle, of if it's mood, it's 6 over the course of 2 to 3 weeks. If it's pain, pain is usually over the course of 5 days to 2 weeks, depending on the quality of pain, the specifics of pain and such. But that's technically, we call that your induction cycle, which is, that's kind of the heavy aspects. And then once you are finished there, then you fall into a maintenance cycle. So the maintenance is you come back when you need to. And do you understand how hard it is for us with clients to say, you come back when you need to? When medicine, we say, why don't you take this every day? Take this pill every day. I don't want you to assess yourself. I just want you to take this pill every day. We do that with every type of medication out there. It could be thyroid, it could be blood pressure, it could be psychiatric. We take a medication every day, and we don't measure our lab values all the time. We don't measure our mood scales all the time. So at Revitalist, we're telling you, we want to help you to individualize your care, and we want you to come back when you need to come back. And we have mood monitoring scales that we utilize to where our providers will try to, and our care team will try to help support you the maximum amount that they know how to. But it's just different. We're telling you to, help us be part of your care team, instead of just listening to what we're telling you to do, and you not reanalyzing yourself at all. Let's just, let's work at this together, and let's figure out, what works the best for you. And we'll give you our honest medical opinion. And we hope that you're honest with us with trying to push you forward to get you out of this hole that you may be in. So that's a little bit about ketamine. I know a lot more about it. And if you have any questions specifically about ketamine, please ask. So let's go to vitamins. Vitamins are a big topic that I've become more passionate about since we opened up in 2018. So vitamins, you don't hear too much about IV vitamins. They're starting to become a little bit more common, but not too much. But IV vitamins, when you take IV over oral, IV is actually 100% bioavailable. Oral is absorbed 40%. Sorry. So oral is absorbed 40%. Oral vitamins Dante. Go outside. Come on, go. All right, back to vitamins. Sorry. Oral vitamins. Oral vitamins are absorbed 40%. IV vitamins are absorbed 100%. Vitamins, what we offer at the clinic, typically we offer something called a Myers cocktail, which is pretty much just a big multivitamin. So there's a physician back in the 1970s who helped to create, what he felt was the best mix of vitamins for our bodies. So what we have noticed a lot with the Myers cocktail is it's actually it's very effective, meaning that a lot of clients will be taking, several different types of vitamins and supplements, and they're just never able to hit the level that they need because orally we're only getting 40% of what we intake. So if I take vitamin C, I'm taking 500 milligrams. The max I'm going to absorb is 200 milligrams. If I'm taking vitamin C 500 milligrams IV, I'm going to absorb 500 milligrams IV. A lot of people argue that, vitamins are water soluble, so therefore you just pee them out. When you're able to hit those intracellular amounts at that heightened amount, then you're actually able for your body to start over 800 enzymatic processes in your body that continue after you pee out those water vitamins. So what they've proven a lot of times with the vitamin C is very, very good as a anti-inflammatory, has a lot of works, to help sterilize the blood if you have something, blood wise going on. It also helps to repair tendons and ligaments. Helps with pain syndromes. They're looking at a lot of the the degenerative disc disease in the lumbar spine, that a lot of people have a lot of chronic conditions with that. They're seeing a lot of good results with vitamin C for that. So vitamin C is actually something that's part of a Myers cocktail. Myers cocktail, you have multiple B vitamins, calcium, gluconate, typically. Some people may use calcium chloride, and then you also have magnesium, and that magnesium may be either magnesium sulfate or magnesium chloride. So these are all medications and supplements. So magnesium, we use it a lot in the hospital system. Same thing with calcium. We use it a lot. We use it a lot in the cardiac units in the operating rooms. Typically when we use it, magnesium, we use it a lot with, really fatal heart rhythms. Calcium, we'll use it to help increase your blood pressure. Vitamin B12 actually just recently being used. It was published in the Annals of Cardiothoracic Surgery, saying that it's actually helping people's blood pressure after they have open heart surgery. So there's a lot of really, interesting studies out there with vitamins, multivitamins, to where if you're able to look at them, if you look up a Myers cocktail, there may not be that much data out there. But if you look at the specific things that may be in a Myers cocktail, there is quite a bit of data out there. It's just the fact of how do you look for it. So, a lot of individuals, like I said earlier, they will go by groups, trying to understand, what are the groups saying? You may not even understand if that person has any type of training at all. I understand that training does go, it does get undermined sometimes. Other people may think that you have to have training to hear anything. I understand there's a variability out there. But what I would tell you is if somebody gives you an opinion, just be sure that you have a second opinion on that opinion, especially if you don't know anything about it, because there's a lot of substances out there, and they may be plant-based, they may be natural, they may be chemically based. They all have their risks and their benefits. So that's the one thing that I would really encourage is with anything out there. I don't care if you think it's the greatest thing in the world. There's always negative aspects to every great thing. So please consider both sides of that. With the vitamins, you should always have a provider. You can ask them what's in the vitamins. And that's, kind of the difference there. Some providers may be able to tell you. If they can't tell you, I would highly recommend maybe going out to another provider, to where those providers will be able to tell you specifically what's going on with those vitamin infusions that you are receiving. Sometimes vitamins make you feel like $1 million, right, as soon as you get them. Other times they may make you feel horrible. The reason they make you feel horrible sometimes is because you're detoxing. Detoxing is not a word that we use a lot in Western medicine, if at all. I guess we use detoxing when people have delirium tremens, when they're coming off alcohol. But detoxing in a healthy manner can occur with vitamin C, and then also another vitamin we give, which is called glutathione. So glutathione is a substance that is found in our system. It's actually found in our liver and our lungs. Over time, our glutathione stores will actually diminish, and that sometimes causes hypertension because glutathione is responsible for the elasticity with the sulfur ions that it has with it in order to help our vessels to stay elastic and help our skin to stay youthful. So glutathione is very common for people who actually get it for skin health. So it's dermatologists will give it sometimes. Some people just come in and say, hey, I just want, want something for my skin. So, that's even a common thing that we get at the clinic, to where, we can just do things for general overall health and wellness. So vitamin C, Myers, glutathione, those are all 3 good supplements that we give at the clinic. We also give biotin, which, a lot of people will understand that biotin is really, really good for the skin. And then vitamin D3. So vitamin D3 is it's gained a lot of attention lately with all the COVID outbreaks. And it's really an interesting vitamin to look at. It's one of our fat soluble vitamins, which we only have 4, which are your A, D, E, and your K. So your D is hard to take sometimes for people, especially if they have gut issues. It's a great supplement to take in a shot, and it's not painful at all. It looks like Wesson oil or Coke or just oil. But I guess just where our body is so loving of fats that it just kind of soaks it right up. So a lot of people will receive the vitamin D, D3 in order to help to maintain their immune health. just to feel better. A lot of people are chronically low. So what is low? Low is less than 30. So in the States, we'll typically say 30 to 100. Actually, in Europe, they will actually say 100 to 200. So a lot of surgeons in the States will not operate on you if your vitamin D level is less than 50. So that's just, pieces of the puzzle to know. And these are, just little things that we've learned along the way, to where, there's just so much more good data out there that I hope that we can continue to share a lot of this with you, to where you can be, expert in your own health. So lastly, I will talk about Spravato. So what is Spravato? Spravato is an FDA approved medication that is actually a derivative of ketamine. So medications, they have, they're kind of a ball per se, and there's a right side and a left side. S-ketamine is actually one of the sides of ketamine, to where it's not as effective as ketamine, but it's a nasal spray. So it's a nasal spray over an IV. And then also we have seen some really good success with Spravato. So people who are, maybe struggling with their mood may have more time to really address their mood. And, are really just looking for just something's got to make me feel better. That's when we would recommend Spravato. So with Spravato, you have to be diagnosed with a major depressive disorder. We require a psychiatrist to refer you to us for the Spravato. And insurance does typically pay for it. Sometimes they don't. But you have to have a major depressive disorder. And then also they just recently approved it if you had suicidal ideations as well. So Spravato is more so like a 4-month induction period compared to ketamine, which is 2 weeks, 2 to 3 weeks. With the Spravato, you come in twice a week for 4 weeks, and then you come in once a week for 12 weeks. And after that, you figure out what works for you. Again, like ketamine, you analyze yourself and you let us know, how's it working? How's it going? Do these scales. Let's try to figure this out. It's one of those things to where let's put mental health into our hands a little bit more, and let's try to figure out what's going on. Instead of telling you that it's familial and it's out of your control, let's figure out what that brain's doing. And that's kind of the really neat thing, is the providers at Revitalist, they have so much training, and that may be in psychiatry and neurology, just comprehensive overall functional health and wellness. The therapy aspects that we have there with the therapist is you're not going to get a stronger team than you get when you come to Revitalist. And that's really the neat thing about it, is if you want to be heard, if you've not been heard, if you're seeking, if you have 10 professionals on your case out there and you don't feel like the right hand's talking to the left, then come to Revitalist. Sit down with a provider, do a consultation and say, hey, I've got 10 people. Will you look at this? Will you help me to figure this out? And we're happy to do that. This is what we've been doing. I'm currently 37 years old. I started working in the hospital when I was 16. I became a nurse when I was 21. So, this is pretty much all we know. We will help you to sit down and we'll help you to understand what's going on. We have had real life training. The ICU, if you've ever been there, it's never a fun place to be. Sometimes there will be 10 specialists on one case. And sometimes the physicians that come in, the cardiologist may not always speak to the neurologist, who may not speak to the psychiatrist, who's not talking to the oncologist. And who is that person in the middle that's actually helping to line up all these streams so the family best feels heard with the patient that's there. And that's really the goal of the nurse. So that's one piece, as the anesthesia professional that I am, we're able to hear. We're able to listen, we're able to understand, we're able to help, and then we're also able to effectively communicate. So I have been in every operating room case there is possible, to where, I've helped with craniotomies, I've helped with open heart surgeries. We did, obstetrics with, epidurals and spinals, and then you do general and orthopedic cases. You can do pediatrics and adults and geriatrics and all those guys, to where, we're comfortable in this space. And what we want to do is the comfort that we have dealing with situations that may be critical or may be hard to talk about, is we want to come out to the outpatient world, and we want to bring this skill set to you to where you can feel heard too. And, right now in the mental health world, our colleagues are needing additional help. They're needing additional providers. They're needing everything because, you can't get into a therapist right now for 3 to 6 to 9 months. Sometimes you can't find a psychiatrist who is taking patients. So what we want to do as professionals is we want to come out into the environment and to help. And the way that we're helping is, we've got the, like people like myself with the expert medical that are integrating the health and the help of the therapists, to where we're able to, do much more. We're able to hear you as a person, to hear your brain, to understand, and to, give you a pat on the shoulder and tell you we got your back. So that's what we're here for. I appreciate you listening to me tonight. And then if you have any questions, please let me know. Please give us a call. We now have a location in Knoxville. We have a secondary location in Johnson City, soon to be opening in Chattanooga and Louisville. So I would invite you, if you have an athlete or a veteran or a therapist, a nurse, physician, lawyer, engineer, anybody who's really struggling, who doesn't feel like nobody's going to listen to them on the level that they feel accustomed to, then we'll be there to listen to you. Adolescents, parents, if you got kids that are struggling, the youngest, like I said earlier, we've treated is 12. So, it might take a little bit more for us to hear your story with the younger ones than 12. But if you've got teenagers that are struggling, we're happy to sit down and try to understand the angle that they're coming from as well, to where they still feel accepted and cared for. So if you have any questions, please let me know. I'm happy to answer anything. And then hope to hear from you soon. And hopefully we can address these crises and just the overall health matters in a very positive way, to where everyone starts knowing what CRNAs are more about, and the effect that we can have on this society. So I appreciate all of you, and thank you so much, and hope to talk soon.